The news comes to you compliments of the National Bank of the Virgin Islands, Digicel, Cyril B. Romney Tortola, Pier Park, Nagico Insurances, Banco Popular, Simply Secure, and NV Salon, Spa, Nail, and Barbershops.
You value traditions. You value music. You value education. Family.
I love you.
Service.
Thank you.
You're welcome.
Love. Life. At Popular, we're committed to you and everything our community values. For the things you value the most, count on us. Popular.
Absolutely astonishing. Now here come Watford.
The 8 world record attempt here.
And here comes Usain Bolt. Usain Bolt storming.
Stop.
Think
Before you act.
before you act.
Think before you act.
As the number of persons infected with the coronavirus COVID-19 continues to climb in the British Virgin Islands, there are many persons who are still seeking certain information before deciding whether or not to be vaccinated. Some of these very questions were put to and answered by Professor of Public Health, Epidemiology and HIV/AIDS at the University of the West Indies, Kingston, Jamaica, Dr. Peter Figueroa.
So is there any truth to Europe refusing to accept persons with the type of AstraZeneca that was made in India? Also, will the AstraZeneca work against the new variants that are out now? And will there be a third and fourth dose to come, especially in light of the fact that one cannot mix vaccines? And can any light be shed on the Cuban vaccine candidates in terms of updates on effectiveness? Before you answer, doctors, I happen to know that in Ontario, at least, they are mixing vaccines. They are mixing Pfizer and Moderna. They are mixing AstraZeneca and Moderna, AstraZeneca and Pfizer. So over to you, doctors, on these
Well, maybe I should begin the answer. The European Medicine Agency is the regulatory authority that rules on which medications and vaccines may be used in Europe. They have put out a release saying, well, someone has put it out, saying that they will not accept the Covishield, which is the AstraZeneca that is produced at the Serum Institute in India. The Serum Institute is a producer that produces the majority of childhood vaccines that we use globally. So they have an impeccable reputation, and they had an agreement with the AstraZeneca Oxford University that developed the AstraZeneca vaccine, and they licensed Serum Institute to produce the same vaccine in India at Serum Institute. WHO accepts that vaccine, and all the experts agree that it is equivalent to the AstraZeneca produced in Sweden. So I'm not sure if it is a technical issue that the regulatory authority, the European Medicine Agency, is saying Serum Institute must submit their data to them, Covishield, and when they submit that data, they will look at it and allow that vaccine. But the WHO has made it clear that even if that is a technicality, it is a discriminatory judgment. You cannot, because some of the people, even in the UK, got the Serum Institute AstraZeneca and not the Swedish AstraZeneca. So that's the first. All the current vaccines, including AstraZeneca, are effective against all the variants of concern. There may be a little decrease in effectiveness of these vaccines, but they're all highly effective against the variants and will protect against severe disease and death. The mixing and the mixing and matching that the moderator just spoke about, they're doing studies now where they're showing that if you get AstraZeneca first, then Pfizer, or Pfizer first, then AstraZeneca, you get a good immune response. But they have not done it in a large enough trial with enough subjects to show that it established that it actually in real life will prevent you from becoming infected. Though most experts accept that because the antibodies are there, you most likely are protected. So they want to do some more studies. Canada has taken the decision, because they're having difficulty getting sufficient AstraZeneca, that those persons who got the first dose AstraZeneca, they will get a second dose of Pfizer or Moderna. So they're going ahead with that. WHO is open to that in situations where a country simply cannot get the same vaccine to give the first dose and the second dose, because there is a significant scarcity of vaccine for many countries, partly because there's not enough production capacity, but also because many of the advanced countries have monopolized the vaccine market through bilateral contracts. They have purchased or contracted excessive amounts. They have reserve amounts. And there's a campaign by the WHO and the experts to try and convince these countries, make available more of the vaccine to those countries that are not getting the vaccine. It's extremely important to monitor the safety and effectiveness of the vaccine as it is rolled out. However, that is not considered to be a clinical trial. A clinical trial has certain parameters to it. For instance, the way that the clinical trials are done to prove or establish the evidence for whether a drug is effective or a vaccine is effective, it needs to be, the participants need to be randomized either to the intervention, to the vaccine, or to the placebo or alternate treatment. And the observers who are doing the study and the participants who are subjects within the study, neither of them, neither the observers nor the participants, must know who is receiving the vaccine and who is receiving the placebo. And when the results are documented and put in a database, the persons who analyze the data, they only know group A, group B. They don't know which group is the treatment group or the vaccinated group and the placebo group. And this is of critical importance, because what you're doing is you're trying to remove the subjective element, the subjective human element from an assessment of the results. So you can imagine that when you do a clinical trial, it is a randomized, double-blind, controlled situation. And even with the adverse effects, you seek out, you ask the participant, if not daily, every week, do you have any adverse effects? Do you have headache? Do you have, fatigue, fever? So it is a very controlled situation. Obviously, when you roll out millions of doses, you can't control it as closely as that, but you still monitor, and any severe adverse event is to be reported and investigated. Still get herd immunity because let's say 80% of people get vaccinated, and out of that 80%, 75% are protected fully from the disease, and only a small number still get the virus, but most of them don't pass it on to someone else. So you can still get herd immunity, but it is quite possible that we may, if we get even as much as 80% coverage with the vaccine, we may still get in other people who are not vaccinated continuing to transmit the COVID and getting sick. When we use the term efficacy, we're talking about how the vaccine performs in the clinical trial. And the clinical trial may take place, different clinical trials for different vaccines take place in different continents, at different times, with different variants circulating, with different participants of different ages. So you have to be very careful of comparing the efficacy of the Pfizer vaccine and the Moderna with the AstraZeneca. Those of us who are in the field don't do comparisons like that. Only if you did both vaccines in the same population, in the same clinical trial at the same time, where you do a head-to-head comparison. So that's the efficacy from the clinical trials. All the vaccines are good, they're effective and safe. In the real life situation, when we roll out millions of doses of vaccine, we talk about effectiveness. How effective is the vaccine as against efficacy, which we reserve for the trials. And in the UK and the US, they've been doing lots of studies. And for instance, the studies in the UK show that the AstraZeneca, which we have been getting, and the Pfizer have comparable effectiveness.
We like to talk about our herbs, such as turmeric, ginger, garlic, and so on. How do these figure into either prevention or treatment of the virus as an alternative to mandating?
Well, the healthier you are in terms of your diet, physical activity, the healthier you are, it means that your immune system is stronger. But no matter how strong your immune system is, with certain infections like measles or COVID or certain other infections, if you are exposed, you are likely to get infected. So turmeric or other herbs of themselves are not going to protect you, nor is sunshine, by boosting up the vitamin D of itself, going to protect you. So that is good, we support it, but you need something more, you need the vaccine. No, I think we need to be respectful of people who have reservations, who have concerns, who have questions. I think it's only natural. And health providers are also humans. They have their own fears, anxieties, and concerns. So I don't think that there is widespread censoring or condemnation of people who have concerns or reservations. And I think we need to be patient, and it's going to take time, and people need time to process. The main thing is to encourage people to turn to credible sources, including their practitioners, and they have to, over time, you just have to be patient. I don't think there's any simple solution here. And that's another reason to me why I think it's too early to be talking about mandatory vaccination for COVID. But let's say the variants really begin to cause a lot of trouble, and health workers are falling down because they are getting sicker as well. Then the question arises, I don't know whether it was Professor Antwine or Dr. Barnett who said it, there are policies in hospitals in the US and elsewhere where health providers have to be vaccinated with some of the established vaccines. All our medical students have to be vaccinated fully, included from hepatitis B and this sort of thing, not yet influenza. But even now we're thinking should we not require health providers to be vaccinated? So we have to always put these things in context. I think all panelists agreed that whatever we do must be balanced. Proportionality, I've made notes in terms of the legal principles, and they sound very, very reasonableness, proportionality, balance, protection of the minority view. But at some point, you then have to draw the line. Yes, we need to use seat belts. We need to chlorinate our water.
Dr. Figueroa was one of 4 panelists on the UCBA and OECS Bar Joint Virtual Forum held on July 8, 2021. He is a member of the World Health Organization Working Group on COVID-19 Vaccines and a member of the UN AIDS Scientific Expert Panel. With this JTV News Update, Kathy Richards.
Attempt here.
Bolt going down, here comes Usain Bolt! Usain Bolt stopping!
We know that where you choose to bank matters, and it is your vote on what your funds do in strengthening our community. As your official Bank of Paradise, we invest and support the lifeblood of our economy by helping in the realization of personal goals for homeownership, education, and entrepreneurial visions, which support small businesses. We make it our place to connect with persons and worthy causes, and we have been doing so for more than 30 years. Where your money goes and what your dollars empower are your choice. And we thank you for choosing us, a bank that gives where it matters the most, for you, for our community, and a happier tomorrow. The National Bank of the Virgin Islands.
Stop.
Stop. Stop. Think.
Think.
Before you act.
Before you act.
Think before you act.
You value traditions. Today. You value music. You value education. Family.
I love you.
Service.
Thank you.
You're welcome.
Love. Life. At Popular, we're committed to you and everything our community values. For the things you value the most, count on us. Popular.
Our reliance on digital systems has opened new vulnerabilities to sophisticated cyber attacks. Simply Secure's security management solution helps overcome these challenges. Our service includes 24/7, 360-degree protection for all computers and servers with automatic restoration, security audits, and penetration testing. Don't wait for disaster to strike. Contact us at info@simplysecuregroup.com.